Hello guys, this is Dr. Possibility from Excel Academy. In this tutorial, I'm just going to explain the arteries of the axilla. You need to kindly take note that there are two important content of the axilla that you need to make sure that you master them. The first one is the brachial plexus, and the second one is the arteries of the axilla. Let's quickly get started and look at some of the diagrams you need to take note of. The first diagram we have been given is this one, and in this diagram we have been asked to label the parts. Let's quickly look at the first part. So if you look at number 1, the part which has been labeled as 1, this part, this is just showing an artery which is moving all the way from this side and is going towards the end. So if you look at this artery is known as the subclavian artery. So when you talk of the subclavian artery, it is an artery which will start changing the names. It will start as the subclavian artery, then it will change to axillary artery, and lastly it will become the brachial artery. But we are not focused on that. Instead, we are interested in labeling this diagram. Let's quickly look at how this is moving. So as this subclavian artery moves, it's going to give off this branch here, which is marked as 2, and this is just the superior thoracic artery. Normally, the superior thoracic artery, it will also give out some branches which we are going to discuss later on in this tutorial. Let's quickly move on and look at 3. 3 is simply the lateral thoracic artery. So if you look at the lateral thoracic artery, this is also branching off from this part of the subclavian artery, but the name normally changes at this region from the subclavian artery to axillary artery. Let's quickly look at number 4. So if you look at number 4, this is simply the brachial artery. So the subclavian artery at this region has simply changed from subclavian to brachial artery. So at this region, we don't use subclavian artery. Instead, we normally use the word the brachial artery. Let's quickly move on and look at 5. 5 is also another branch which is coming from the axillary artery. Remember, from here to there, the word which will be used is the axillary artery. Then from there to there, we normally have the subclavian artery. So when you look within the subclavian artery, there are some branches. So there is this branch which is here, and this branch we are going to discuss it later on in the tutorial. But we have this this artery which is just simply called the subscapular artery. The word sub just simply means below, and scapula just from the word the scapula. That means that this artery is going towards the scapula. Let's quickly look at 6. 6 is just the posterior circumflex artery. It is also coming from the axillary region. The next one is the anterior. So you have the posterior and also the anterior circumflex artery. So when you talk of the posterior normally looks as if it's going down the region, and then when you talk of the anterior, it's normally going up, because posterior means down and anterior means up. Then circumflex, it means like it's more like moving at a certain rotation, or it's rotating. Let's quickly move on and look at 8, which is just the thoracoacromial artery. So 8 is just the thoracoacromial artery, and this thoracoacromial artery, it also gives out some branches. And let's quickly look at the last one, which is 9, and it is known as the axillary artery. Remember, take note of the branches. The first part I talked of, from this region to that region, it's known as the subclavian artery. Then from that region, just after the clavicle, it is known as the axillary region. And then once it reaches this point, up to that point, it's known as the brachial artery. Let's quickly look at the next diagram. This is one of the insertion diagrams that you need to make sure that you take note of. So remember, I said from this part to that part, from this part to somewhere, that part, it's the subclavian artery, then you have the axillary artery, and then you have the brachial artery. But let's quickly look at number 1. So if you look at number 1, this is just the superior thoracic artery, the same one which we discussed in the previous label. Then from there, we can look at 2, which is just the thoracoacromial artery, and then this thoracoacromial artery is just going toward the thorax region and also the acromial region. So this thoracoacromial artery, it normally gives offward some branches. You have the pectoral branch, you have the deltoid branch, and you have the acromial branch, and you have the clavicular branch. So let's quickly look at those branches. So the first one, it is the clavicular branch, which has been labeled as 3. Like I have said, we have the thoracoacromial artery. This thoracoacromial artery, it is just moving toward the thorax region and also toward the acromial region. So when you talk of that, we can look at the branches which the thoracoacromial artery gives out. The first branch you can look at, it is the pectoral branch, which is this branch, and this branch is normally going toward the pectoral region. And then the other branch you can talk about is the deltoid branch, which is going toward the deltoid muscle. Then the other one you can talk about is the acromial branch, which is going toward the acromial region. And the other one, which is the clavicular branch, which is just simply going towards the clavicle. This is a clavicle. Okay, so let's quickly look at 4, which is the pectoral branch, like I've said, coming from the thoracoacromial artery. Then we have the acromial branch, which is going toward the acromial region, and it is coming from the thoracoacromial artery. Then 6, which is the deltoid branch, which is going towards the deltoid muscle. Let's quickly look at 7. So if you look at 7 here, you need to look at, you have the posterior and you have the anterior. The anterior normally seems as if it's moving on top of the posterior circumflex artery. So if you look at the anterior circumflex artery, it's moving above, it's on top of that. So most of the time, when the person is being injured at this region of the humerus, you need to understand that the most vulnerable artery to be injured, it is the anterior circumflex artery, which is just moving on that part of the humerus. Then if the person is stabbed from the back, you need to expect the posterior circumflex artery to be injured. So these are the 2 guys which you can take note of. The first one is the posterior circumflex humeral artery. Some of the literature, they put humeral, but others they don't. So you need to understand that for the sake of safety, you can put the humeral weight. So the humeral weight, it just simply stands for the humerus, because this artery is normally moving around the humerus. So that's why it is called the posterior circumflex humeral artery. Number 8, I've already explained, it is the anterior circumflex humeral artery. Then let's quickly look at number 9. So if you look at number 9 is branching off from the axillary region. So if you look at that, that is just the subscapular artery. So the subscapular artery, it is just simply mean that this artery, the major objective, it is to supply the lower part of the scapula, meaning it's going toward the scapula. So if you look at this subscapular artery, it's moving like that. Then later on, it will normally go around again. It will send a branch which is going towards the latissimus dorsi. So let's quickly look at number 10, which is a branch of the subscapular artery. So number 10 is just the circumflex scapular artery. Remember, we had the circumflex, the posterior circumflex humeral artery, the anterior circumflex humeral artery. Now we have the circumflex scapular artery, which is branching off from the subscapular artery. So this circumflex scapular artery is normally going toward the region where you can find the scapula. Let's quickly move on with and look at the next branch of the subscapular artery. So the next branch is just known as the thoracodorsal artery. So the thoracodorsal artery, it is an artery which is moving towards the thorax region and on the dorsal part, meaning at the back region. The next guy we can look at is the last guy, which is just the lateral thoracic artery. Remember, we once looked at the posterior thoracic artery, which was our label number 1. And then we finally have the last one, which is the lateral thoracic artery. Please make sure that you master all the labels and make sure that you are able to label these diagrams without looking at the solutions. Let's quickly look at the last diagram. These are the same arteries of the axillary, but in this case, these are just some of the few arteries that were left on the previous diagrams. Let's quickly start with number 1. If you look at number 1 is just simply the subclavian artery. The subclavian artery. So the first one is known as the subclavian artery. Then if you look at B, from the subclavian artery, there is an artery which is going upward. So if you look at the up artery, which is B, it is just the vertebral artery, which is going toward the vertebral and it's going to supply the vertebra. Then let's quickly look at C. C, it is just the internal thoracic artery. So you have the internal thoracic artery. After you understand the internal thoracic artery, the next artery you need to consider is D, which is just the thyrocervical tract. So the thyrocervical tract will give rise to 3 branches, which is the first one is the inferior thyroid artery. Then you are going to have the transverse cervical artery. Then you are going to have the suprascapular artery. After you have the suprascapular artery, these are just arteries which are first originating from the subclavian artery. So one thing you need to understand that this subclavian artery is more like the source and the main branch. So this subclavian artery will normally give rise to the internal thoracic artery. Then you need to expect on your right hand side or on the left hand side anatomically, you're going to have the vertebral artery. Then you're going to have the thyroid cervical tract. So the thyroid cervical tract will give rise to 3 branches: the inferior thyroid, then the transverse cervical. The reason why this is known as the transverse cervical, you need to understand that it's also going to send more branches. Then from there, you're going to have the suprascapular artery. So major arteries, which are a branch of the thyrocervical artery, are one, the inferior thyroid artery, transverse cervical, and also the suprascapular artery. That's very important for your theory MCQ questions. Then the last guy we can look at is H, which is just the dorsoscapular artery. The dorsoscapular artery. Please make sure that you go through this video. You also make sure that you revise these diagrams by simply restarting the video and also pausing so that you write down and then compare your answers with these solutions. Thank you very much, guys. This was Dr. Possibility from Excel Academy. Please make sure that you subscribe to our YouTube channel and also make sure that you register with Excel Academy.